Hi everyone, welcome to the Big Ideas Theater at AARC. I'm Ed Highland. I'm joined now by Stacy Cutts, who's with the University of Texas Southwestern Medical Center Zale Lipsey. Thanks so much for coming by.
Thank you.
I want to talk a little bit about how to implement a respiratory-driven vascular access program. Give us some thoughts, first of all, maybe just the big picture of what it's all about and kind of where you would like to go.
Yes, I was practicing respiratory therapy in Arizona, where they have a very successful vascular access team that's driven by RTs. And so I relocated to Dallas and recognized there was a need for vascular access during the evenings and weekend hours. And so from there, I knew the model worked in Arizona, so I took that model and implemented it at UT Southwestern. And so it's been very successful. We are into 2.5 years at this point in time, and just a great program.
Now give some thoughts on actually getting it implemented. I mean, you have to convince the C-suite.
Yes.
You've got to, I mean, there's some dollars involved. How do you go about actually setting all of this up as a team and then convincing the powers that be, so to speak, to make it, to implement it?
Yes, actually what I did was I got position statements from AARC, how they support the initiative with respiratory therapists, and I went to the Texas Medical Board to get approval to make sure it was in our practice act in that state. And also there's infusion therapy standards of practice. They also recognize respiratory therapists as a vascular access specialist. So I took all of that information and went to C-suite, and also we looked at the turnaround time from the time of order to the time of placement with their current model before we implemented this.
Now, is this a customized team? In other words, as far as size and content, that sort of thing?
It is customized. It all depends on the size of your organization, the volume that you have, and the complexity of the patient needs.
Give us some thoughts on the impact this has had on morale, for example.
Oh, it's been great for morale. Well, this is what it does do. It definitely engages employees. So some of the therapists that I work with, they've been doing respiratory therapy for years, just like me, and now it's a new skill set, so it totally reinvigorates them and gets them engaged in a new procedure.
Give us some thoughts on actually getting certified in vascular access. How important is it, the benefits of it, both professionally, personally and professionally?
Yes, there is a board certification for respiratory therapists and other disciplines, nationally recognized. And what it does, it adds credibility to your team. And it is a difficult exam to take, but definitely worth it because of the knowledge that you acquire getting prepared for that exam.
Can you share some thoughts on the makeup of the team? As a layperson, I would be curious as to how you go about basically recruiting the members. Do you sometimes have more members? Do you set up multiple teams if you have that much participation, willing participants?
Yes, every hospital has different models. So there's blended teams that consist of nurses and respiratory therapists, or there's that model with just one discipline. So we currently, at one location, we have respiratory therapy doing vascular access. At one of our other locations, it's a nurse-driven program. So we're looking at combining in the future to have that both disciplines interacting to get the best of both worlds, actually.
And the value, I guess, of coming to a conference like AARC and some of the other regional conferences, because I mean, it's a continuing education situation.
Yes. And I think there's a lack of awareness of the need for vascular access. And so we have a lot to bring to the table because we're there 24/7. We're critical care specialists, and so it is definitely in our skill set to be able to provide this service.
Do you cross-pollinate with other teams? In other words, do you contact them or and maybe at a gathering such as this, where you get a number of people together, exchange ideas?
Yes, we do. We have a local network. The Association for Vascular Access has networks throughout the country. And so we do have a local network in Dallas. And so we do meet every quarter and have a speaker and to provide continuing education also.
Is it a situation where we were talking before about getting it through the C-suite, so to speak? It's a budgetary item. I mean, do you have to basically apply to continue on every year, You said you've been doing it about 2.5 years now, or is it once it's in place, you're golden?
Once it's in place, as long as you demonstrate the value to the organization, and I keep a lot of data, and so that I can consistently speak to our turnaround time. That's one of my quality measures. Is before we started the program, the turnaround time was 11 hours. Now we have it to about 3.5 hours. And so you always have to be able to speak to the benefits of the program to the organization. And UT Southwestern is just a great organization to work for. And so they totally embraced it because they want the patient to have the right device at the right time by the right discipline.
Well, this reflects well on the organization as well. I mean,
Absolutely,
certainly.
yes. They've been very supportive in helping drive the initiative and get the word out.
Well, Stacy, I want to thank you so much for coming by and sharing this very important information about vascular access. And hopefully some folks will also participate in asking some questions so they can also set up their own programs, get their own teams going.
Yes, absolutely.
Thank you so much for joining us. This is
Thank you.
the Big Ideas Theater at AARC. I'm Ed Highland. Thanks for joining us.